On 25 April 2015, the earthquake Nepal had long been preparing for struck. More than 8,000 lives were lost and 18,000 people injured in the magnitude 7.8 quake, straining the country's health system to the brink.
In front of you, you have line tank. Yeah, more than 150 guest house there. All down. Wow. The glacier. And this is glacier, this is ice. All this.
But I don't even see any wood. I don't see anything.
No, because it's below the glacier.
Yeah, but when it came down here, the air blast has destroyed the forest on the far side of the valley.
Over 500 health facilities around the country were damaged or destroyed, and the risks of disease outbreaks were heightened. But for over a decade, Nepal's Ministry of Health and Population, with the support of the World Health Organization, had been preparing for the worst scenario by assessing and retrofitting health facilities, developing preparedness plans, conducting training and drills, pre-positioning medicines, and setting up emergency operation centres.
More than 60% of the districts are affected, and we in the UN country team also have an opinion that when we rebuilt the country, rebuilt the health system, we should not be that too much rushing out and doing the rebuilding. Rather, we should be doing more systematic way, assessing in terms of the location of the health centres.
Knowing the vulnerabilities of the country, WHO Nepal and the Emergency and Humanitarian Action Programme of WHO's Southeast Asia Regional Office had gone through several steps in preparedness as well. These included holding contingency planning workshops, WHO office drills, revisions of emergency plans, and stockpiling health supplies and office and ICT equipment. This was done so to roll out operations in the aftermath of a damaging earthquake. And when disaster actually struck, the government, backed by WHO and eventually hundreds of national and international health and medical teams, shifted into emergency response mode.
What's been really impressive during this response so far is that the Nepali medical teams have been out in huge numbers. They brought in teams from the west and east unaffected areas into the central devastated region, and they're working hand in glove with the foreign medical team.
The investment in preparedness paved the way for an unprecedented, swift and appropriate response.
Nepal is in the earthquake zone, and we are aware of that. And therefore, we have to be prepared for any eventuality. There could be another earthquake. So we have to be ready for that.
Within 2 hours, WHO was in close coordination with the government and offered its support. Funds were distributed through the Southeast Asia Regional Health Emergency Fund to meet the immediate critical needs in the first few days of the disaster. Pre-positioned WHO stocks of interagency emergency health kits and diarrhea disease kits in Kathmandu and Bangkok were mobilised. WHO Nepal staff were quickly deployed in the 14 most affected districts, supporting Nepalese government counterparts.
This is more than 100, about 120 foreign medical team they have deployed in different places, and the more of 100 national medical team they have also deployed in different places. The WHO has tremendously supported this.
Staff from across WHO responded, providing public health, logistical and vital coordination and communication support to Nepal's government. Hundreds of medical and humanitarian organisations have registered with the WHO-led Health Cluster and Foreign Medical Team Initiative, providing life-saving and essential healthcare to all 14 affected districts. But great needs persist. The major 7.4 magnitude quake of 12 May was a terrible reminder of the dangers ready to strike. More people are injured and needing longer-term care. More hospitals and clinics that, after the first quake, were only partially damaged are now no longer functioning. More people are displaced and more health challenges exist. The rainy season will soon be upon the country, bringing with it new health threats. These include landslides and avalanches, threatening lives and blocking access to healthcare and other humanitarian aid, and communicable disease outbreaks such as diarrheal and respiratory infections. WHO is responding to the risk of outbreaks by helping strengthen disease surveillance systems. WHO and health partners are committed to supporting Nepal as it continues to respond and help the country build back stronger from the 2015 earthquakes.